Let's go. Come on, get up, cause you tuned into the station for your morning motivation to get your education for your health and your spiritual needs. Yeah, strong will to empower the people, to promote the peace, though. Positive attitudes, baby, that's a lifelong dream goes. Yeah, health matters and we're here to help you become the better you, to be the best you, the best version you can be. Yeah, and it's time for this classic, fantastic food for your soul. Here's Jackie and Coach Patrick right here. Let's go.
Health matters to me.
Hi, good morning, CSI. This is Jackie.
And Coach Patrick.
And you're listening to Health Matters here on WAAW Shout 94.7 FM, the voice of the gospel truth.
This is another beautiful day the Lord has made.
Hey, and we're going to choose to rejoice and be glad in it, Coach.
That's right. We're going to do that all the time because the joy of the Lord is our strength.
Yes, it is. Yes, it is. He commands today because it is the day that he has made.
And I'm feeling strong today.
I know it.
I'm feeling real strong.
I know. And we have to intentionally set our day. We have to command our day. We do. We talked about that last Saturday, but we have to intentionally command our day. We set the tone for our day. Now, we can't control what's going to happen. This week someone kind of cut me off on the road, and and I immediately it almost triggered something, but I had to remember, Jackie, you already command your day. Don't react to that. And I immediately just started singing my songs and just kept going. So we can't control what happens, but we can control how we respond to the situation. So not allow our emotions, we just respond safely and wise with our emotions. So that's good. That can be hard sometimes. That takes practice, right. But yes. So
you make a good point, and that's why you try to start that day off thinking positive.
Yes.
Because if you started off wrong, your whole day will be.
Oh yeah, somebody say something, and it triggers
those little incidents that you have.
Absolutely,
it trigger the negative out of you.
Yeah.
So set that bait for positive.
So happy Saturday, guys. We are moving into our 4th week of this August. I tell you, August is just blooming on by here,
so it's rolling.
But yes, it's rolling. Fall is in the air, guys. So I hope you guys in expectation and waiting, because I don't know about you, I'm ready for some fall weather.
It's hot. Hot as it's been in
Just past hot, Coach. Just past hot.
Well, listen, guys, we've been talking about GLP-1's for the last couple of weeks, and today we're gonna hear from Dr. TrieJaye McDowell. She's the doctor's perspective on GLP-1's. She's out of Chicago. We'll give you more information about it when we get close to bringing her on. But we just want to go ahead and acknowledge our sponsors, our partners, our friends. Aiken Chiropractic, Dr. Dan. When your spine is aligned, your body is too. Aiken Chiropractic is located in 425 Lawrence Street, Northwest Aiken, South Carolina. Sorry about that. The number is 803-641-9191, and their website is www.aikenchiropractic.com. And Centerwell Senior Primary Care. They're helping seniors live healthier and happy lives. They're located at 3435 Riceboro Road in Augusta, Georgia. Their number is 706-841-9719. Their website is www.centerwell.com. And Graham's Vehicle Detailing, affordable mobile detailing with professional results every time. Their number is 706-830-4982. And their website is www.grahamsgvd.com. All right. So if you would like to be a sponsor, a partner, or a friend of the broadcast, you can call 706-592-8862. We'd love for you to help us do what we do. And also, if you would like to get your brand out there on a weekly and daily basis, you can always call the radio station here. We have many packages that you can purchase to get your brand out there on advertising. You can call the radio station at 803-649-6405. All right. Happy birthdays, happy anniversary to everybody.
Yes.
That's celebrating birthdays and anniversaries in this great month of August. Keep celebrating yourself. keep celebrating yourself.
Yes. Celebrate yourself,
If it's your month, keep celebrating.
Absolutely. And I think we miss Connie and Craig Riggs. They celebrated their 37th year anniversary. So happy anniversary to you guys last week. So continue to enjoy each other and continue to grow together.
Most definitely.
Yes.
Today's broadcast is pre-recorded, so we just want you to know that. You can't call in or anything like that, but it is pre-recorded. But if you do have questions, hold them to next weekend, and we'll be glad to attempt to answer your questions, or we will get answers for them. So without any further ado, Jackie, I think we're ready for our
Dr. McDowell from
Dr.
Chicago. You like
McDowell.
Coach said, yes. We've been talking about GLP-1s. And so from our perspective, from healthy lifestyle coaches, DPP, healthy lifestyle health coaches. And so, but we wanted to bring in a doctor from a doctor perspective to talk about this who specialized in this. So her name is Dr. TrieJaye McDowell. And she is a BCADM CDC's pharmacy doctor. She's board certified advanced diabetes management and certified diabetes care and education specialist. And she's going to tell you a little bit more about her, but we are so glad we connected in Atlanta at a training. And so we immediately connected with our conversation. So we want to continue this conversation. So without further ado, we're going to bring on Dr. McDowell from Chicago, Illinois, down in the house, talking with us in the Windy City. Hello.
Hi there. How are you? Thanks
How
for
are
having
you?
me.
Thanks for being here.
Thanks for being
Absolutely.
Taking
here.
time out of your busy
Absolutely.
schedule to be here. We thank you so much for being here with us on this morning to talk to the CSRA community. If you could just go ahead and let the community know who you are, and then we'll jump right into the interview.
Yes, absolutely. Well, thank you again so much, both of you all, for having me today. It's my pleasure to talk about diabetes anytime that I can. As previously said, I am Dr. McDowell. I'm from Chicago native. Woo!
Right.
Um, yes. I have been studying diabetes for a very long time. I actually have a very different story. I too managed type 1 diabetes from childhood. So
Wow.
a lot of my interest came just from, my life experiences and things like that. And so whenever I have the opportunity to talk about medications that affect not only the general public, but people that are directly in my community who are managing type 1 and type 2 diabetes, I'm always on board.
Awesome. Well, again, we thank you for being. And how's the weather in Chicago?
The weather is a little iffy. We just had about several storms here. They kind
Mm.
of passed their way through the Midwest. So we're just praying for, some 70s, give us some 70s and some dry. I feel like we had a late summer, so we're trying to hold on for dear life over here.
Good.
All right.
We're in the hundreds over here in
In
Augusta.
Georgia.
Oh, wow. Oh, wow.
Yes.
So we're
Well, we'll
trying to
take the
stay.
70s. We'll take the
I
70s.
know, right?
We will too. But Dr. McDowell, we've been talking about GLP-1s, and we kind of started off with just, the surface, just
Understanding.
helping people understand what
Mhm.
GLP-1s are. And then
Yeah.
we came back and we talked about do they work and, what they do and
hmm
things like
hmm
that. So I just want you to jump in, there and go ahead and get us started, and we'll go from there.
Yeah, I feel like it's such a hot topic, right? Anything that, from a general perspective can help people to lose weight here, especially in America, is going to be something that we always talk about. Because starting with GLPs, we kind of start to talk about why, right? There's so many different indications, there's so many different reasons. And to be honest, a lot of people are going to be taking them for their own reasons. And so GLPs, just to keep it on a very surface level, there's something called incretin hormones that um, mimic our body's natural responses. So I'm very careful because the medications like the Ozempics, the tirzepatides, and all of these other GLPs that, are formulated to be like our natural hormones. So they're like them, but they are not exactly like them. And to try to kind of explain it in the most simplest way is the ones that are man-made, like the Ozempic and things like that, they have a much longer, what we call half-life, meaning that they're going to last a lot longer, right? And so the ones that naturally occur in our bodies, they only last for seconds or minutes, very, very short half-life. So they're there and they're supporting us, but in states of like obesity and type 2 diabetes that kind of are associated with diabetes, they just don't work long enough. And so when the FDA kind of rolled out these medications, I was very impressed. And actually, they came out a very long time ago. We're just sort of catching up, but they are going to work a lot longer than our natural body processes have them to work.
That's good. Now, you talked about how the GLP-1s, and I think you were referring to the natural hormone that we have that sometimes don't work the way they should, and I think that's associated with underlying conditions like diabetes and obesity, like you said. So that pushes people towards the agonist, which is the GLP-1 medication. Uh,
Yes.
would I be right in saying that?
Yes, you're absolutely correct in saying that. Yes.
Yeah.
Oh,
Okay. So we've seen now we know that the GLP-1s, when they first started, it just started for diabetes. And that's what most prescriptions were being written for, diabetes and things of that nature. But then it jumped and pushed into the weight loss thing, and not just obesity, but just cosmetic type weight loss.
Mhm.
What are your feelings or thoughts on that?
Well, I kind of see it from a different perspective, just kind of being immersed in medicine, right? Um, if I am a person and I am trying to manage obesity, anything that can help me to kind of get rid of some weight as my initial barrier, we're gonna want, right? And in
Right.
a way, we don't really want to gatekeep those things because if we think about people in America, just phenotype, the way people are looking, we're a lot bigger than a lot of other people all around the world. And some of our food processes and things like that here, they just kind of change our appearance, and sometimes our appearance, it affects us health wise, because it's not always about appearance, but it's about the underlying risk factors that are associated with that. So if I had to think about the widespread use, because I think that that's what you're asking me, how do I feel about that?
Mhm.
um as long as there's proper monitoring and there's an association of education that's there, I do think that it's a popular thing. And also, there's a huge segue that kind of talks about cardiovascular health. So we don't just always use GLP-1s for affecting people's weight and just an anti-obesity perspective, but we also use it in a way to kind of partner with the person and help their different outcomes, like cardiovascular. Of course, there's renal significance there, and many other factors and glucose management and things like that. So it really just depends on the person.
Mhm.
But to really answer your question, I don't really have a problem with it as long as, a provider is associated.
That's
Yeah.
good.
that's
That's
good.
good. And
That's right.
and one of the you had something to say,
No,
Jackie?
no, no. Go ahead.
Yeah, and that's great because if it's needed, then it's a good thing to have. It's not a trend. It's not a fad. I mean, these medications are here to stay, and they are beneficial. You know, like you
Yeah.
say, based on what a person needs it for. I think right now I've seen something about the VA hospital now is even looking into GLP-1s helping people with alcoholism, uh,
Hmm.
to help in that area. So
Yeah,
so
that's
they're
cool.
finding, yeah, they're discovering a lot of benefits for this medication. But
Hmm.
we know that with medication, a lot of side effects come. And as you said, people just need to be aware, of the decisions they make when they get on the medication, just like any other medication. You know,
Absolutely. And to kind of add to what you just said, I feel like, when I think about GLPs and the GIPs, the GIPs, I think about tools. It's
Mhm.
a tool.
Yeah.
So it's not a house that you could just go dwell in, right? It's a tool to kind of help you to build the house, as a metaphor, right?
That's good.
It is the things that you need, and some of these things you already possess, right? Because we talked about them being naturally occurring, not the drugs themselves. I want to be very clear that the Ozempics of the world, the Manjaros, those are not natural drugs, but they're kind of used to activate that pathway or enhance it a little bit. And
Mhm.
so these medications are tools that we use to lead to a healthier lifestyle. That's the part that I feel like a lot of people kind of miss, because when you take it, whether you take it orally or whether you inject it, you almost get instantaneous results, right? And when I say instantaneous, I mean literally within a month or two, you're down pounds. But what does that say about what you're doing besides the medication.
Now we're
And
talking.
that's where I want you to expound on,
Come on, Doc.
because
Yeah,
they need to
yes.
hear that.
The
Yes.
behavior
Yeah.
change. The behavior change. Yeah.
Yeah, the behavior changes and just your overall thought process about how you feel about yourself, right? So if I am a person and I am managing obesity and I am taking Ozempic or any of the GLP-1s, right? Because there's so many for us to actually choose from. Yes, I'm gonna lose that weight more than likely, depending on, the things that I'm doing. I'm gonna drop some form of weight is gonna come off. But what happens if I stop it?
Mm,
What will happen, right?
yeah.
We would expect for that weight to come back. So now at that point, you are left to rely on what are some of the behavioral changes that you made during that time. But if
Hmm.
you have not made any, you're going to get all of that weight back and you're going to lack behavioral change. So we have to kind of make sure that we're coming into it when we're putting patients on these medications with a plan. But it's also very important that you have education from an educational standpoint, because that education is going to be or should be very well rounded. You could have a registered dietitian, you could have a certified diabetes lifestyle coach. You could have a BCADM, which is just it's a fancy way to say, a person to help partner with you to help manage your medications and also manage your disease state. So I think that, looking at this as like a tool or a toolbox is going to be more relevant than looking at it as like a magic pill, right?
That's great.
Yeah.
That's great. And I like how Dr. McDowell talks about, you know, look at it as a toolkit in our box,
Yes.
because it needs to work together with other things, especially because sooner or later they're probably going to come off of the medication, at some point, and you want to have those healthy behaviors in place,
Right.
so that you can, just naturally keep the weight loss as much as you can, with having those new behaviors that you created throughout the time you've been on this medication that was helping you, get to that weight that you want to get. Now, not only that, but I have the skills and the strategies I need when it comes to maintaining those things.
And that's why it's so important to have, like you said, that dietitian, your diabetes health coach, and us to help lifestyle coach to help you coach you through this and navigate you through this, because you're going to need that, because coming off of it, it's going to be hard to sustain that weight loss. Let's
Hmm.
talk about sustainability, Dr. McDowell, right now.
Yeah.
People that have gotten off, have gained the weight back, or they gotten off. Is it harder for them to maintain that weight once they come off?
Well, I believe so, yes, right? Because when we think about the body, we think about our natural or normal physiology. I was speaking about this a little bit earlier. Everybody looks different. Everybody is going to appear different. There's genetics that come into play, and then there's something that we see. There's the phenotype of a person, and it doesn't. It just means that we're different. Some people have larger muscle mass, things like that. So what the body does when you come off of medications like GLP-1s is it basically wants to take you back to your regular normal state. And so, the hunger noises may come back, your body connecting, your stomach connecting with your brain saying, I'm hungry. Because I'm hungry is it's not a behavioral thing. That's something that's natural to
Mm.
someone. If you're feeling hungry, we even talk about hunger pains and things like that, because your normal physiology has certain requirements, right? And that's going to be very, very different for every single person. So when we think about sustainability, it kind of goes right back to what we talked about. Yes, it's going to be a lot harder for you to keep the weight off if you have not practiced ways to do that without a medication in the first place.
Mm.
So whenever we're thinking about medication, we always want to think about it in the sense of a team. It is a player or a couple players on the team, right? If we think about Manjaro, because Manjaro has GIP and it has GLP. So those are a couple of players that are working together. So much so that they even formulated them together. So you have to kind of think about the same thing as yourself being a player, but also your behavioral changes, also having maybe even being like your coach, right?
Mm.
Because the coach is directing everything. So your behavioral changes are in a sense that way. So yes, it will be a lot harder, just because you're not partnering with anybody and you don't have anybody in your team, but it does not mean that it's impossible.
Right. And that's where that self-discipline comes in at, if you're not going to have that support network of professionals or, people that are in the community that are trained to help you, then you
Hmm.
kind of really have to have that self-discipline to hold yourself accountable, to your journey, to your health journey and to what you're trying to accomplish. You brought up some very good things like everybody's different, right?
Yes.
Everybody's
Absolutely.
different. Their body responds differently based on their age, based on their ethnicity. All of those things matter,
Hmm.
and we have to take those things into accountability. And I like Jackie talks about embracing who you're becoming a lot,
Hmm.
and I
Yeah.
think that plays a major part in us as we're aging. We have to just know that some things we're not going to be able to change,
It's
right?
Yeah.
hormonal.
And we have to learn how to embrace those things,
Right.
love
And
ourselves, I
Absolutely.
yes,
guess. Yeah.
yes. And I liked about, we last Saturday we talked about the habit loop. If we're not doing anything to change, and I tell my clients all the time, the behavior they really they don't go nowhere. If you're not making any type of changes to help rewire your thinking or your brain, these these habit loops repeat themselves because
Yes.
soon as something triggers something, you are going to immediately go to that coping mechanism
Hmm.
that you normally go to because
Hmm.
I have not put nothing in place to replace that old habit loop. So
Yes.
let's kind of talk about that and expound
Yeah.
on it because I'm very passionate about behavior changes.
Hmm. Yeah, that's so important. When I hear you talk about that, I immediately think in my mind about the person who is, just starting. Let's use Ozempic, right? Let's call it semaglutide because there's multiple different versions and how it's formulated. So if a patient is, taking semaglutide, let's say that that person is dealing with obesity. Let's say that they're 400 pounds when they start. And then they start to lose that weight. Well, guess what happens? They have to look in the mirror and they're looking at an entirely different person.
Mm.
And
Mm,
so, what they need to do is, in a way, they need to connect with that person. And then there's going to be behaviors that's going to be associated with it. And then that's the kind of way that you kind of break that loop a little bit. It doesn't mean, breaking it is not a bad thing in a way, but it is establishing a healthier path for you. Oftentimes, a lot of patients that I see when they're losing weight so quickly, of course, in addition to some of the medical things that we see, osteopenia and things like that, we also see psychological changes, right? Because you really have to get used to the person that you're looking at every single day. You have to
mm,
form some bond with that person. So that's really important to kind of help you whether you want to fit in that loop, if that's a healthy loop, or if you want to kind of get out of that loop because you are bringing almost a whole new person into existence when you're starting these because you will not be the same person that you were after you start taking it. And if you are, I want to know, what positive things for positive reinforcement are you using to make sure that, you are still kind of that same person. I hope that that makes sense to the listeners.
Yeah, I think that
that
makes
make a
great
lot of
sense. And I
sense.
like how you say the positive, reinforcement because it's not about condemnation. Like you said,
No,
you're getting totally used to a totally different body. And that
absolutely.
body's not going to look the same. And then there's other things. If you were really obese or had a lot of weight to lose, then now you probably be dealing with sagging skin and other things. Now that is driving is causing you to pay attention to, and what do I do about this now? Now that I've lost the weight,
Hmm.
So
Hmm.
yeah.
Yeah.
Positive
And that
reinforcements is
and that goes back to the different players on the team that Dr. McDowell was talking about. I may need a personal trainer for strength training because we do lose people do lose at least about 40% of that muscle mass
Mhm.
doing these. And is I'm correct saying that, Dr. McDowell?
You lose a great deal of muscle mass. I can't speak to exactly one because each medication is going to be different, right? And like we talked about, every person is going to be different. So depending on, what starting doses, of course, I'm hoping that everybody's using the FDA labels as a guide to start patients and to manage them. But the quicker that you're going to be losing weight, the more effects you're going to start to see. And I wouldn't necessarily stop at bone loss, right? We also see retinopathy or we see vision issues. Sometimes when we're quickly losing weight, there's going to be a lot of different factors that come into play. And in order to properly manage them, then you're going to need players on that team. So you're going to need people to kind of go to, even if it's just a support system, right? Of
Right.
course, you want to put the healthcare provider in there, but there's many peer educators and people that are your peers, people who also have taken these medications. And I'm not necessarily talking about, the Reddit groups or anything like that. I'm talking about actual places. There's diabetes prevention programs. There's local services that you can kind of go to with people who are managing these things, but also have peer education and things like that as well.
Right. One of the things, and I think you kind of hit it a little bit, that this is not a magic pill, and there's other things we need to do to make it work and work together with the medication. But when it comes to age groups, what is the main age group that you're seeing that are on these GLP-1s?
Yeah, so I work with a lot of the Native American population. I work with an urban Native American population. So for me, it just all depends. I don't have a lot of elderly or older patients taking this medication. A lot of mine are patients who, maybe have had a pregnancy if they're women within the last 4 to 5 years. And we know, depending on how that pregnancy went, there may have been an existence of gestational diabetes. There's always going to be influx in hormones around pregnancy and things like that. So some patients kind of fall into that category. And I would say maybe that's like the upper 30s and 40s.
Mhm.
And then in males, it kind of is around the same thing too. And it really just depends on risk factors. With my population, it's a little bit different because there's a lot of disease states that are higher. Of course, speaking about diabetes is one of the highest amongst Native American people. And so it just really depends. But I would say the upper 30s and the 40s, those are the age groups specifically that I'm seeing a lot.
Okay. Are most of your patients diabetes patients?
Some of them
What would be
are.
the ratio for
hmm
diabetes
So,
versus weight
so I
loss?
have a complete set of diabetes patients, and then I have some that are not. So, yes, a lot of my patients are actually managing diabetes, but I
Mhm.
do have a subset. I would say maybe about 25% that are not diabetes, but they're pre-diabetes. So they have that metabolic syndrome. They have those issues. They're having the excess weight. They're having the hunger noises. They're
Right.
having a lot of things that are indicative of, possibly feeling like they're obese, or maybe even their BMI is showing that they're obese, right?
Mhm.
So I would say it just kind of depends. And it also depends, we talked about this a little bit earlier, the geographic location, right?
Mhm.
What is the proximity to a healthy grocery store or a grocery store that has fresh produce? Where are you living? A lot of time for my patients, are you on a reservation or are you actually living in an urban city? It
Mhm.
really just depends.
Well, I tell you, it's just amazing how the dynamics change with the demographics, different areas that you may be in,
Yes.
some things we don't even think about, that being in the South or down here, what we're dealing with,
hmm
versus what you're dealing with. So if I hear you right, then most of your patients are diabetic or pre-diabetic. You're not really dealing with the weight loss push.
Every now and then.
Just,
So
and I'm
I
just saying for only weight
yeah.
loss. Yeah.
So I work with two providers, two wonderful providers that do offer those services, and we assess. So we kind of get together, we sit at this long table, and we talk about different factors in these non-diabetes, non-pre-diabetes patients that are looking for help with weight loss. So we look at factors. One huge population that I see quite often is patients that are managing PMOS, which is previously PCOS, which is the polycystic ovarian syndrome. And so one of their main things is that they're dealing with insulin resistance, right? And so sometimes with that, there can come excess weight. There can come many other different factors that kind of come into play that almost closely resembles diabetes,
Mhm.
but they're not managing it quite yet. And so we see a lot of benefit from people that are managing that disease state that are, going to benefit from weight loss.
Mm.
Awesome. You had mentioned something about the elderly. You don't see a lot of elderly people. I know that a lot of elderly people they use it. I think they're one of the highest group that use it for diabetic reasons.
hmm
Yeah, but
what age group would you consider
I would say
elderly?
60, 60 and above. Yeah.
Okay.
I'm talking
Okay.
60 and above. And I
Okay.
just bring it up because I was reading something
Mm-hmm.
on the GLP-1s and who's using it.
Mm-hmm.
And one of the reasons why they said that the older adults, 60 and older, was just using it for diabetic reasons is because they couldn't get it from could get Medicare to cover the cost just for weight loss.
Well, yeah,
Yeah,
that's the biggest.
right.
That's a huge, huge barrier that I probably could go on and on about, right?
Mhm.
I promise I won't, but that's a huge barrier. Even in patients, Coach Patrick, it'll be patients that are managing sleep apnea. The FDA gave an indication for Zepbound to be used um, for sleep apnea, but it's so hard, to get it covered for patients.
Mhm.
And sometimes the same thing goes. So I don't know if I'd necessarily class 60-year-olds as elderly, but I probably would call them, older adults.
Mhm.
I do see some that are older adults. For me, I think it's a caveat because, I work with Native Americans. So these insurances and these certain limits of care do not apply.
Mhm.
However, when I am working with the other providers, I see quite a few people who come in wanting the medication and are met with a "I can't pay for it" barrier.
Mhm.
And I think that oftentimes when patients are that age and they're coming in, it's because there's other barriers, right? I
Right.
can't exercise physically. I had a total knee replacement, had a
Mm,
total hip replacement. I'm
yeah.
having such a hard time being able to be active. I don't have a healthcare, I don't have a caregiver, right? I'm
Mhm.
caring for myself. I'm impoverished, so I'm eating very unhealthy canned foods. So
Mm.
these are a lot of different things that, are associated with ages that are 60s.
Health
Because
equity. Yeah.
yeah, and they're not always in the workforce. They're not always in the labor force anymore, right? So you
Mhm.
have to make sure that what monies that you get every month is going to cover the foods. And it
Mhm.
may not play out the way that you want it. So you find yourself kind of with these barriers of trying to manage obesity but not being able to get the medication. So so
That's
so
great.
yeah,
Yeah.
I think those are reasons why you may have found that a lot of those people in that age group are looking for that medication.
Yeah. Now, Medicare is doing a pilot program. I think it
Yes.
started in July 1st.
Yeah.
It's going to
Read a
run
little
through.
snippet on that.
Yeah. So it's going to run through December. So that, those that do need it, of course, there's some qualifiers out there. And it's
Hmm.
not just for the elderly or the aged adult. I'll just say the aged adult because I'm 60.
Yeah.
I'll be 60
I'll
in
be
October, so
60.
I don't consider myself an elderly. I would say an older
Okay.
adults.
Hmm.
I'll be 62 in September. So.
Okay.
Okay.
But
Okay.
but yeah, so Medicare is doing that, which is going to be great, and it's not
Hmm.
just for aging people. It's also for those that are, low in income and things of that nature. So
Yeah.
that,
You
that
know, since you've mentioned that, right? One thing that I would love to see them do as well, if you are going to, gracefully do the pilot program and allow people to get it, I love that. I'm so rooting for that to win. I would also hope that in some way they require education, right?
yeah.
Almost as if
There
a
you go.
requirement.
Self-education.
Yeah, exactly. Just requiring it because we know we've talked about it for about 30 minutes now, right? How
Mhm.
important that team member is. So it will be even more beneficial if the people who are going to be willing to cover and pay for it mandate that or really strongly encourage it in some way. So I really, really hope to find something like that that is really strongly recommended to pair with the access to medication.
Yeah.
I mean, that's a great
Wellness
point you make.
education,
Yeah.
and that's one of our mission statement is
Dude,
to help people to be self-educated. And that's what we do
right.
as health equity navigators in our community. We go, partnering with the Department of Health, to help to bring awareness and educate our people
Hmm.
in the community, not only just the rural community, but in our faith-based community as
Absolutely.
well. And so my husband and I, are blessed to be our wellness director for our church. So
That's
we're able
wonderful.
to put information out on
Hmm.
a monthly basis.
Hmm.
So we thank God we have leaders that allow us to
Yes.
share that with our congregation.
Yeah. And what better way to try to demyth, right?
Right.
You can
Oh, yes,
demythify these things when you're in your
yes,
churches or in your YMCA's. I see those spaces as safe spaces, and I see them where peers can come and, as long as they're educated in the proper subjects and the proper things, they can share things with you. I feel like that's a really wonderful environment to take away from some of the negativity or the
right.
stigma that's still surrounding it. I hear oftentimes, this phrase that I don't love so much, even though I understand what they're trying to say. Oh, the Ozempic face. You know what I mean? So,
Mhm.
so it is those type kind of stigmas and negative
Right.
things that are attaching themselves to these medications, and they're creating myths and negative connotations. And so if we create these spaces that are within our churches, that are within our YMCA's, our Boys and Girls Club even, because you can never really start too early with education,
Right.
then
Right.
you can destigmatize it from an earlier stage all the way to, when a patient is standing at the pharmacy. Because these thoughts are going to repetitively, because you talked about that loop, right? That
Hmm.
behavior, it's going to
Yes.
constantly go through their heads.
Right.
So if we can kind of band together at a level even before the access of the medication comes or even during, then I think that we can really make a change here.
Yes.
That's
And just
awesome.
the collaboration in the community, even remember we had one of the things we had a problem within the training, that we talked about is the disconnected with the doctors. If we can
That
just,
bridge,
that
yeah, from the
bridge, if
medical
we can
community.
just
Yeah.
get our doctors to get on board with us as
Yeah.
health coaches.
As referrals
We
and stuff.
we are here. You can't get out in the field as much as we
Yeah.
can. And so if we can just get, and that was our biggest thing there. If we can just could get our doctors to get on board with us and like, hey, we're here, we're right
Yes.
here.
Yeah.
Because, you remember in the training, Dr. McDowell, when the GLP people kept popping up in the rooms, and
Mhm.
it was like, it was funny, but
Mhm.
they was making a point.
Mhm.
We're not going anywhere. Let's just
Yeah.
work together.
Yeah.
And if we,
Absolutely.
yes, we can just work together, and come together, connect the doctors with us,
Mhm.
and I'm praying they working on that. Emory University and this
Mhm.
all them are working on this.
Mhm.
Let's connect. Let the doctors know we are in the community,
Mhm.
and we just being missed because,
Mhm.
like you
Yeah.
said, not only let's not just add myth being myth informed, but they are being misinformed.
Oh, absolutely. Oh,
Yes,
absolutely.
right.
Social media is running rampant
Oh,
with so
yes,
many different things. And we're very blessed to have social media, but at the same time, it can miseducate people and kind of
right.
do things in that way. So I wholeheartedly agree with that. Absolutely.
Yes, absolutely.
Now we
Go,
go ahead.
you go ahead.
Go ahead.
Now we talked about all of this, and so let's kind of talk about the pros and the cons and the what possible if there can be long terms effect.
So
Using meds.
Yes,
what I
using.
yeah, what I would say is that we don't know.
Yeah.
Mm,
We don't know. That's literally the best answer that I
Yeah.
could give
yes.
from a pharmacy perspective as well as from a diabetes perspective. We just simply don't know. I think that the manufacturers are doing an okay job with clinical trials and studies. I think that what is going to have to happen is that, those very complex clinical trials, because these medications are being so widely used, are going to need to be translated into lay information, right?
Mhm.
Because we don't want to be so sophisticated and so inaccessible, as you talked about, Coach Jackie, right?
Mhm.
Not being able to relate to our patients information that is so technical and so high. So just to kind of rewind just a second, I wanted to kind of address what you said about, you're missing us. I absolutely agree with that. And I think that maybe one of the ways that we can kind of tackle that is to create create access to somebody that doesn't necessarily have a white coat but does have that information, right? So I
Mm,
do have to kind of give like a little bit of a shout out to my people who have CDCES, all of my educators, my registered dietitians, the real supportive staff, my pharmacist, of course, right? The people that you can just walk right into the pharmacy. You don't have to have an appointment and you can talk to them.
Mm.
about anything that's on there. So I really believe in order to tackle that barrier of, hey, you missed me, is going to, have access to some people who are very supportive of the people who wear white coats and very supportive of the systems like Emory and things like that, right? And then to just kind of transition back a little bit, I feel like with patients, we need to make sure that we're not technically talking. We've all been there, right? Where we
Mm.
will want to do something, but we're afraid to do it because we don't understand. I think the best example that I could give, right? I want to eat healthy. Let's say that, right?
Mhm.
And then I grab a bar, a healthy bar. It just says healthy bar on it, right?
Yeah,
And then I
come on.
turn it around to read the label of the ingredients.
Come on. You teaching our lesson that's coming up on the
There's
29th
there's
about looking beyond the front.
fructose cereal top syrup, hydrocoral, nothing. We have not, and there's nobody that's going to explain it to us.
Right.
But on the label it says healthy bar,
Yeah.
right?
Yes, right in the
So
front.
yeah, so we need to figure out a way to take these really high level studies, right? Where we're talking about hazard ratios, we're talking about benefits, cardiovascular benefits, renal benefits, all those things, and we need to translate that into something that people can go online and we can read it.
Yeah.
It will leave everybody still intact. If you're a nurse, you'll still be a nurse. If you're a
Yeah.
doctor, with that information out there, you'll still be a doctor and you'll still be smart. It
Come
doesn't take
on.
away, right?
Absolutely. And
One
you
of the
have go ahead, Doc. Go
No,
finish.
I was just gonna say gatekeeping should not be a thing that we should be doing at this high level.
That's it, because we have too many people that need us
Mhm,
and need our help. So it's like, okay, GLP, they're not going anywhere. We help lifestyle coaches. We're there. We're not going anywhere. So
mhm,
I like what you just said. That needed to be heard. We're not taking anything from you. We're adding
mhm.
to it.
Absolutely.
And I wanted to say, kind of piggyback what you said, the education part in doing, we go to seminars, we go to places. And so now we tell them, okay, this is what we need to do. This is what needs to happen. But in the meantime, from the time of receiving that information
Yes.
and actually doing it, you got all that space. What's going on in here? What's going on in that middle? Come on
You
now.
I think just as humans, we can be a little resistant to change, right? Whether
Mhm.
we admit it or not. And
Right.
I do think that in a way, sometimes information, if you don't have 100% the right mindset, it can be intimidating. It
Yes.
can be very
Overwhelming.
intimidating. One of the things that I've noticed from my own personal life with type 1 diabetes is, there's a sense of rebellion sometimes.
Mm.
I can know as a person, right? That if I don't take my insulin, my sugar is going to be high.
Mhm.
Sometimes I'll, maybe in my younger days, right? I would be, well, okay, that's fine. That's just something that I'm going to have to deal with. And too often we're experiencing people kind of doing that same thing where it's like, okay, well, they gave me all of this information. I'm so busy. My show comes on. Oh, I have to walk my dog. Oh, my kids, I got to go get them. There's so many other things that, you may need to do that information, it just makes you want to prolong it. It's because you know why? It's kind of like what you said. We're not going anywhere. Oh, I could
Mhm.
do it next week. I
Right.
don't have to read it this week. I can kind of sit on it. So what we need is I believe we need the people who are the supportive staff, right? We talked
Mhm.
about the CDCES, we talked about the nurses. Um it needs to be preliminary and it needs to be interactive, right? So
Mhm.
if I sit here on the computer screen and I say lose 5 to 7% of weight, do this, do that, you're going to just, keep that as a note in the back of your mind. But if I work out with you every week,
Mhm.
and I ask you, I say, hey, Jackie, what did you eat last week? I'll tell you what I ate. Let's talk about it. That's interactive. That
Right.
has an effect directly on my life because it is with intent and it is with doing. So it is action, right?
Yes.
Versus just, information. Information is very powerful and we all have it at our fingertips, but we don't always have that spark. And so I believe that once we
Mm.
spark a person by partnering with them and joining and kind of doing things, then I
Right.
think we'll get better results.
Yes, yes. And I always I always ask our client the why, what is your why? Because that why
Yeah,
behind your
yeah,
what, your why activate the what.
yeah, of
So if you
course.
have a purposeful and meaningful why of why I'm doing this,
Absolutely,
so
absolutely.
I tell people it's like a match, you know, that match is not going to get lit by itself. Something
Yes.
has to ignite it.
Mm-hmm,
First,
mm-hmm,
we gotta desire it. We have to want it, and
mm-hmm,
and
mm-hmm.
and and, and like in coaching, I don't know if I told you, my first coaching that I took was Valerie Burton Intense from CAP Institute of
Okay.
positive coaching. I took that intense coaching, and it was a game changer
Wow, that's
for
great.
me. That was my first before I became the diabetes health lifestyle coach. But I took her coaching, and it changed my life. It really changed my life and looking at things from a different perspective. But
Yeah.
yes, just knowing that why, and then also tell yourself the truth. Will you lie to yourself? Tell yourself the truth,
Mhm.
because I always tell people, if I say something, or if I'm aware of something, if I see something, I'm gonna ask, okay, now
Mm-hmm,
you ask yourself, is any of it true? You
mm-hmm,
go ask. Don't tell me, you go ask.
mm-hmm.
So when I have that meaningful why and purposeful why, I always can pick, okay, wait a minute, this is why I'm doing this. I'm not doing it for the vanity. I want to
Mm-hmm.
lower my A1C. I want
Yeah.
to be around for my grandkids. I want to be able to. So when we have call it a qualified lie, a
Yes.
lie. I said lie. Why? We have something we can pull on to
Mm-hmm,
remind us why
mm-hmm,
I'm here, why I'm doing what I am doing. And
mm-hmm,
so that's what we try to get our clients to always, okay, when they have a minute, hey, what was your why? What is
mm-hmm.
your why?
I
You know,
love that.
I mean,
Yeah.
so when we get back there and remind them of that and
Mm-hmm,
coach them back into their, they're like,
mm-hmm.
okay, thank you, Jackie. I just need it. I just had that moment. And
Yeah.
you can have that moment, but just make it a moment.
Yes. I
Yes.
absolutely
Yeah.
agree with that.
Yeah.
And just to kind of piggyback on what you said, because I love that so much. There needs to be a self-reflection, right? There needs to be something before you start, which is your why, because I believe that we should start there, to be honest.
Mm-hmm.
And then there needs to be constant self-reflection. And this doesn't need to feel like homework. We're taking a medication
There
that's
you
supposed
go.
to wanting to benefit us. But we do understand that there are also things that these medications can cause that we didn't have in the first place. So the reflection is also going to be very important, not only for your why, but understanding how to keep yourself on board and keep yourself able to learn as you go. I would never want any of my patients to take anything blindly because of something that they read online or Google or anything, or even something that they see, in the next person. Because in a way, you don't want to covet what somebody else has in any way, right? Whether it be appearance or things either. So you want to make a plan for it to be yours. You want to have ownership of it. So I love that concept of why. And I
Yeah.
really think that we should start there.
Yes. I love it. This
That's
has been
good.
great. It's hard to get
I
off here.
stepped out for a second and it seemed like I was on another subject.
Oh man, I mean, hey, we just allowed it just to flow,
Yes.
because I feel her passion, I
Yeah.
feel her heart for the people, and I have a statement that I say, what comes from the heart reaches the heart, So
Yeah.
when you flow together like that, but when you have that passion and heart for people,
Mhm.
that's going to be an instantaneously connection,
Right.
and in my world, I wish we all can
And
be like this.
yeah. And in this field and in this industry, you got to have
Yeah,
a passion for what you do. If
you
you don't,
have
you're not
to.
going to last.
Mm-mm.
You know,
Yeah.
and if you're in this field, if you're in this industry dealing with people with
Hmm.
behavior change and things of that nature, you
Sure.
got to be up on what's going on with
Yes.
GLP-1s. You got to
Yes.
be up on what's going on with
And you also
GLP-1s.
got to give grace, because I have a pet peeve. My husband, we've been training for over 37 years. I've been training and coaching, and I'm like, I see some younger trainers and out here now, and I'm like, you're not getting it, you know. And
Yeah.
so you got to show some grace. No, there is accountability, but you got to understand changes that happen in people. You got to understand people
Oh, yes.
mindset and how they think.
Mhm.
So I just see some of them, not a lot, but what I see, you think a person just supposed to get this information. It's easy to just show and get the information, but to be able to
Absolutely.
coach that person through this,
Mhm.
that's a whole different ball game right
Right.
there.
Yeah.
And then help them understand why they
Yes,
need, again, back to that toolkit, need not just the medication, but also the behavior change education.
right.
Go ahead, Dr. I
Correct.
know
Yeah.
something's on your mind. Something.
Correct. No, I am in agreement. Absolutely. Absolutely.
So,
You have to know what you signed up for.
right.
You
Yes.
can't blindly do things, and you have to also have an underlying why. So I absolutely agree.
So we're getting to that time now. I did want to ask one question before I just allow you to just close out with, whatever's left on your heart that you
Sure.
want to share with the community. Um, the cost of the medication. What's really driving that cost to be so
Yeah.
so high like that?
Well, anything that can be beneficial to any person who takes it, right? That's not going to be cheap. That's
Right.
going to be something that's expensive. And that's just from my point of view, but
Mhm.
also from a medical standpoint, a pharmacy point of view, you know, there has to be a recoup of costs. These are not small little things or just small little pills like other medications historically have been.
Mhm.
These are, hormones. These are incretin hormones that are,
Mhm.
made to be injectables. And so that's not something that's cheap. Clinical trials cost a lot of money. And so when pharmaceutical companies kind of delve out to do these studies, they're not necessarily doing them for free.
Mhm.
They are, having to recoup and to pay the people who actually investigate them. So a lot of different barriers are going to be there. The question that I pose though, because we don't always want to jump on one group of people. We also want to talk about the people who will cover them and say that they're not covered. You
Right.
know,
Mhm.
um, tell us why did you decide to do that, especially if that a medication has a certain benefit.
Mhm.
Let's use an example. I'll make this very quick. Let's go back to sleep apnea with the tirzepatide, the Zepbound though, right?
Mhm.
If I have a patient who has sleep apnea, and then they also have obesity, and they also have pre-diabetes, if I'm an insurance company, I think that it's a little unfair if I decide that, well, you know what, because it's an anti-obesity medication, I don't care what it's being used for, I'm going to exclude it.
Mm.
I
Mm.
don't think that that's something that should be done, but those are very common practices, right? And
Right.
they may have their very valid reasons as to why they do so, but I would wait until I hear it before I have empathy at all for it, right? Because that in a way is gatekeeping. And
Mm.
that's not what we want to do with medications that have a cardiovascular benefit, that have anti-diabetes benefit,
Mhm.
that has renal benefit, and that can really, help prevent, or I'm sorry, help better manage a patient who is dealing with a chronic disease state. We can really look at the entire burden of a healthcare cost if patients have access to those drugs in a much beneficial way. And I think that's what, from a medical perspective, that's what we're all looking to do. That's what Medicaid looks to do. That's what a lot of these things look to do, is to decrease the burden of costs to take care of one person, right?
Mhm.
And so we need to kind of start thinking about that. So I don't just blame the insurance, the manufacturers for having these costs so high. I also would ask, not blame, but ask the insurance companies, why do you exclude them?
Right.
Right.
It's a good point.
That's a good point. That's a good point. That's a question that is out there, guys. If
Yes.
you
So
out
I
there,
hope you're at a table and you're sharing these ideas and these things like that, on a higher level. level because people need
Yes,
to hear it. Yeah.
Yes, and that's
absolutely.
why I was so drawn to you because we instantly connected at the table.
Yes, we did.
Uh, and I say we got to get her on the show. I say I don't know how, but I knew, and I thank you so much. I appreciate you
It's my
for being
pleasure.
here to educate the public, the CSRA about this information because it needs to be out there. We need to be educated on this. And then if you're out there, you're listening, you're driving, you're on our app, guys, take in this information. Go back to our YouTube page, go back to our Get Fit with Jackie Fitness Wellness on Facebook and re look at all of these interviews that we have done this month and educate yourself because that's what we are here to do,
Most
to
definitely.
educate our public through wellness education.
Most definitely.
Absolutely.
All right. So, Dr. McDowell, any final comments?
My final comments to pretty much everyone is, don't be afraid of information. Do not be afraid of information. If there is a study and you want to know more about it, try to read it. You may not be able to pronounce the words, but you know what you can do? I'm sure you can find Coach Jackie, you can find Coach Patrick, and you can kind of use them to help figure out the answer. I do that for myself all the time. If I don't understand something, I will read it anyway, or I'll glance at it anyway, just to give myself some awareness of it.
Mhm.
And then I'll maybe take it to somebody else who, if they don't have the answer, they have the connections, right, to figure out what this is and the proper answers for me. And also, don't be afraid of information, but understand that you're different from everybody else. So even in taking the medications, you're not going to do things exactly the same way as somebody else, right? And thank God for that. Because there are certain populations of patients who just don't tolerate the medications, right? And maybe be thankful that if you take it that you could, but it may show up differently. So empower yourself with
Mm,
medication, get rid of that fear, and please, 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 if you're considering the medication, just don't compare yourself with everybody else.
Right.
If anything, just use the information to try to understand how it's going to affect you directly. And please use your pharmacist, use your coaches, please talk to your nurses. Everybody doesn't have to wear a white coat to have information to explain to you and to kind of partner with you, because I promise you, so many people are rooting for you, and so many people look just like you that are rooting for you as well. So I would say that those are my 3 takeaways.
Awesome.
it is
Awesome.
awesome,
Again,
awesome,
thank you,
awesome.
Dr. McDowell, for being here with
You're
us.
so very
And
welcome.
we look forward to having you again.
Yes.
Yes, thank you.
We-
And thank you for all the work that you guys are doing locally. And thank you for traveling and taking yourself to these conferences where you're able to meet different people. And I can meet people like you guys as well. So very, very much appreciated.
yes,
Awesome.
appreciate it. Now we used to be in Chi-Town. We used to come there all the time.
Schomburg.
Well,
Schaumburg.
we need you guys to come back. Absolutely. We have lots and lots of gaps. So we're always looking for support.
All
Okay,
right.
Doc.
All
You
right. Well,
enjoy the
Doc, well,
rest
you
of the day.
enjoy the rest of your day,
Thank
your
you.
week,
Thank
and
you.
your
God bless
month.
both
All
of you
right. Looking
guys.
forward to reconnecting again.
Yes,
All
my
right.
pleasure. Take
Okay. Bye bye.
care.
Okay. You too.
Bye-bye.
Bye bye.
Awesome.
Awesome, awesome,
Great
awesome
information.
interview. That was
Yeah.
great, Coach. That was great from a doctor's perspective, kind of put a um different perspective on it,
Most
So that,
definitely.
but what
That
I'm
it
proud
did.
of, pat ourselves on it because we're up to date and up to par,
Yeah, we try to do what we can do.
yeah,
And
we ain't
that's all we can
perfect,
do.
but we do our research and we connect with doctors and different people
Yeah,
so
gotta
we
have a
can,
network.
yes, so
Can't do
we
it
got
by
to,
yourself.
you can't,
But
no,
we
you
got to
can't.
get off of this station right now.
Yes, we got to get off. But guys,
This-
thank you for listening. We want you guys to have a great
Yeah.
Saturday. Be safe out there, and um, yeah,
Yeah, stay tuned. Stay
stay
tuned
tuned.
for the Concerned
It
Ministers
is-
Fellowship, which is coming up right after us at 9 a.m. You Matter, Pastor Bush, 11 a.m. Saturdays with Sean, and then 12 p.m. Midday Motivations with Alicia G and Tony D with the New Artist Profile. And then our weekly programs are coming up. Make sure you tune in for our weekly programs.
Yeah, we'd like to thank you for listening to Help Matters here on Shout 94.7 FM, the voice of the gospel truth. Remember, we are here to help you to become a better you, to be the best you that you can be. We like to leave you with 3 John 2. Beloved, I wish above all things that you may prosper and be in good health, even as your soul prosper. Guys, you have a healthy and blessed day.
Health is life. Your health matters. You matter. Health begins in the spirit and the mind. Take time to love you. Live well. Be well.
Yeah, let's go.
Health matters to me.
Come on, get up, cause you tuned into the station for your morning motivation to get your education for your health and your spiritual needs.
Health matters to me.
Yeah, strong will to empower the people, to promote the peace, though. Positive attitudes, behavior, that's a lifelong dream goals.
Health matters to me.
Yeah, health matters and we're here to help you become the better you, to be the best you, the best version you can be.
Health matters to me.
Yeah, and it's time for this classic, fantastic food for your soul. Here's Jackie and Coach Patrick right here. Let's go.
Health matters.